Dr. Jaffe, can you explain the cellular processes that occur and cause lymphocyte reactions only when the antibodies are reactive and not to those protective antibodies?
Yes, I'm happy to help people understand that helpful antibodies are just that. They're neutralizing, and they do not release complement. They do not release the chemical signals that tell a lymphocyte, on guard, be aware. And in fact, there's one more step, which is included in the functional LRA by ELISA assay, which is that the antigen we're testing is actually picked up by an antigen-presenting cell, an APC, an antigen-presenting cell. And we have some preliminary videos that show antigen-presenting cells wiggling over to lymphocytes, presenting the antigen, the processed antigen, the antigen that's harmful, along with any antibody that has recognized that antigen. And so the antigen-presenting cell presents at the MHC locus. That's the place where the key fits into the lock of the cell. And only harmful, complement-fixing, complement-generating antibodies provoke lymphocyte responses. And so lymphocytes are smart enough to distinguish what laboratories cannot. So when laboratories measure antibodies today, say by an ELISA or an EIA or an IgG antibody test, they're measuring a substance, a quantity, but not the function. And so they pick up both helpful and harmful antibodies, whereas cells are smart enough to know that helpful antibodies just soak up any little bit of foreign antigen that comes in and do not activate the complement system, which in turn calls attention from the millions of lymphocyte cells that circulate. Fortunately, our LRA by ELISA Act uses lymphocytes in the patient's own plasma with everything present except for the red cells. And so we're able to do a functional assay with cells reacting just as they do in the body. And thus our assay, the lymphocyte response assay, the LRA by ELISA Act, can distinguish helpful from harmful because we use lymphocytes that are smart enough to distinguish whether complement has been activated, whether harm is potential or not.